Hey everyone, it's Kristen with the Massage Space, and welcome to part 1 of our series on low back pain. So in this video, our goal is to help you identify what the source of your low back pain may be. If you're looking for tips on how to reduce your pain or improve your situation, you're going to want to click on the video that's called Alleviating Low Back Pain. Again, in this video, our goal is to just identify what the cause may be. So the reason that we want to address low back pain is because 80% of adults struggle with it. That means 4 out of 5 people, and that is a really high number. So there are 2 types of pain that we usually see. There's chronic and acute. Chronic is the one that's been around for a while. So the technical time frame for it is 12 weeks or longer. That's 3 months or longer. So if you're one of those people who's had back pain for a year, you have chronic pain. And then there's also acute pain, which is a short duration and more commonly seen with injury. It usually resolves itself in 3 to 4 weeks, so about a month's time. And there are 4 main causes of low back pain that we want to take a look at in this video. That's not to say these are the only causes, but these are 4 major ones that we see pretty commonly. So a muscle strain, a disc herniation or bulge, a vertebral subluxation, which is just a fancy term really for a misaligned vertebrae, and then pelvic rotation. So let's go ahead and take a look at a muscle strain. A muscle strain is an overstretched or minor tear in a muscle, and more commonly you'll hear people refer to it as a pulled muscle. And typically with a muscle strain, the symptoms that you're going to see are inflammation and muscle spasm. And oftentimes this is caused by bending, lifting, and twisting. So you think about if you have a job, let's say you work at UPS and you're bending over to lift heavy boxes and twist to turn them and set them behind you. It's really common to see a muscle strain on people who have that kind of work. The other thing that can cause it is a sudden movement or fall. And then also sports injuries, again, especially when there's lots of twisting involved. So think like golf or baseball. So with a muscle strain, the pain usually comes on suddenly. A lot of times people can actually pinpoint what they were doing when they strained that muscle. And then generally it will stay in the low back. You're not going to have pain that's moving down into the glutes or leg, but it'll stay kind of right there in the area of the injury. And then most of the time you'll find it difficult to stand or walk. Again, these are generalizations, but these are just common things that we see with a muscle strain. So let's go ahead and take a look at the second thing, and that is a disc herniation or bulge. So there's a difference between the two. A herniated disc is where the middle of that disc, what's called the nucleus pulposus, people refer to it as the center of a jelly donut. So with a herniated disc, that part actually breaks through the outside of the disc. And then with a bulging disc, you actually just have the disc literally bulging into a space where it's not supposed to be. You can see the difference in the picture here. So with a disc herniation or bulge, risk factors are the main one that we see a lot of times is disc degeneration. So this is just a common thing that happens over time, natural wear and tear of the discs. One thing that goes along with that is actually a lack of water content in the discs. So if you're not drinking enough water, you're actually going to be more prone to this. And then being overweight is definitely a risk factor because you're going to have that much more weight bearing down on the space between your vertebrae where that disc sits. And then also physically demanding jobs, especially those where you're lifting heavy objects. Again, that same kind of thing where if you are lifting heavy stuff, you are squishing that space where the disc sits. And then the final one that a lot of us are prone to is excessive sitting. Because if you're in the seated position and your posture isn't the way that it should be, you're collapsing that space in between your vertebrae, again, just like all those other things, where you are squishing that disc and keeping it in that position for the whole amount of time that you're seated. So oftentimes with a disc herniation or a bulge, you're going to have radiating low back pain, meaning that it's probably going to travel down into your glutes and your leg. And this is because most of the time with a bulging disc or a herniated disc, you're going to be having some nerves involved. And so when you have nerves involved, numbness and tingling are really common. And then weakness in the muscles around and honestly even lower or higher than where the actual bulging or herniated disc is not uncommon at all. The third thing that we want to look at is that fancy term I was talking about, vertebral subluxation. Again, you can see the picture here. It's basically just a misaligned vertebrae or a vertebrae that's out of place. So you can see that second one from the top there, the one the arrow is pointing at, it's slightly out of place and it's causing excess pressure on the disc below it. So with the vertebral subluxation, this will be caused oftentimes by trauma. So let's say you're in a car accident, or you've fallen on the ice in the winter, or maybe you were skiing and took a fall. It's not uncommon to have a vertebrae just kind of pop out of place. Another thing that will cause this is muscular imbalance. So you think about this, there are muscles that operate on both sides of the body, and there's a balance that has to happen there to kind of keep things in place. So when you get muscles that are pulling too much or muscles that aren't pulling enough, they can just pull bones right out of place. And then finally, stress is actually a thing that can cause a vertebral subluxation. And oftentimes people don't even think about this because stress places so much extra tension in the body that, let's say you're super stressed and you have loads of tension in your body and then you sneeze or something really random. All that stress and pressure in the body can actually cause a vertebral subluxation. So with that misaligned vertebrae, typically you're going to see pain that is both local in the low back, and then sometimes it can even be radiating depending on how severe it is. And then stiffness is really common. Just as with any joint, when it's not working properly, you're going to get stiffness in there, whether it's a knee or a shoulder or a vertebrae in the low back. Stiffness is going to be common if it's not, working the way that it should be. And then finally, muscle spasms. Most of the time with a vertebral subluxation, you're going to basically have what are called your erectors on either side of your spine. They're just going to tense up and you're going to have muscle spasms. Excuse me. And then finally, the fourth thing we're looking at is pelvic rotation. So with pelvic rotation, there's a neutral place for your pelvic to sit. And this is where, everything around your pelvis is kind of in balance. It's aligned as it should be. And let's say, you fall or you're sitting a long time, that pelvis can get put out of place. Basically, it's either rotated forwards or backwards. And so we're going to go ahead and take a look at a picture here that actually shows what can happen when we do have muscular imbalance. So you'll get a tight low back, a tight hips in the front, and then you'll have weak abs and weak glutes and hamstrings. This is actually called lower cross syndrome. And this is really common, especially because we all sit so much. So when you're sitting for long periods of time, those muscles are actually, basically held in that position, and they start to kind of take that form. And so when you go to stand back up, those hip flexors in that low back, they're still tight. And so eventually over time, it just kind of rotates that pelvis. The other thing that can cause pelvic rotation is trauma. Again, you think of like a car accident or a fall. That can definitely, rotate your pelvis as well. So again, those four main things that we're looking at are a muscle strain, a disc herniation or bulge, vertebral subluxation, and pelvic rotation. So thank you guys so much for watching this. If you're looking more for tips on how to help alleviate your low back pain, definitely check out that video. But again, I'm Kristen with the Massage Space, and make it a great day.